Hi there. Thank you for coming to our talk today on caring for the caregiver. I just wanted to first say this is going to be fairly informal, so if you have questions or any comments to say during the presentation, please just raise your hand or just speak out and we'll address them at that time. But there's always questions available at the end of the presentation. I wanted to first of all welcome you to Harrington Family Health Center. As you know, we are the Community Health Center, and we're very excited to begin providing additional community presentations and educations for anybody who would like to join, such as this today. Here at the Health Center, we are an integrative team, which encompasses family health, podiatry, behavioral health, and also dental. Being an integrative health center, it allows you to meet most of your healthcare needs in this one location, which I think is really great and pretty extraordinary for this area. Again, thank you for coming, for you being here in person and anybody who's viewing live and watching this stream live. Tonight, I'd like to bring light to the importance of caregiving. Caregiving is very special to me. Growing up, my mother was a caregiver, and also caring for my grandfather who had dementia. So I hold it very true and tight, and it's part of me, and I find it to be a very special topic. While I was obtaining my master's at DeUval College, my thesis project was on caregiver burden with dementia patients. So both topics of dementia and caregiving I hold very special to my heart. Today I would like to talk about caregiving and specifically caring for the caregiver. In the roles and activities, family caregivers, also known as informal caregivers, have a major influence on health and well-being of their loved ones. The decline of family caregiver health is one of the most major risk factors of hospitalizations of their loved ones, and there is evidence that care recipients of caregivers who lack effective coping styles or have problems with depression are at a risk for falling, developing preventable secondary complications such as pressure sores, and experiencing declines in functional abilities. So you can see that making sure that our caregivers are well holds true throughout the whole spectrum. Next slide. Perfect. So I'd like to begin, first of all, discussing what caregiver means. There's a few different definitions out there. Foremost, a person who provides direct care to another person, whether it's children, elderly, or the chronically ill. And that's pretty much the basic definition of caregiving. And next slide. There are two types of caregivers. The one that we'll be speaking of today are the informal caregivers, also known as family caregivers. And that is an unpaid individual, such as a spouse, a partner, a loved one, a neighbor, or a friend, involved in assisting others with activities of daily living or their medical tasks. And then there are also the other spectrum of caregivers, which are formal caregivers. And that's paid providers, providing care in someone's home or in a care setting, nursing homes, long-term care facilities. Next slide. There's been a significant amount of research that has been done in caregiving, but it hasn't always been true. It's coming more in the forefront and being seen more as something that's very important to discuss. The research really was kicked off in the 1980s. And that was when caregiving became a key part in the psychosocial research in the 1980s. A lot of behavioral health started this initiative, and realizing caregiving being such an important role. There was Zahart and colleagues in the 1980s. It was one of the first psychologically oriented research done on family caregiving. There was also a Schultz and Beach caregiving research that discussed the mortality risk factors of caregiving in relation to caregiver burden. Informal caregiving has been one of the most popular areas of research in gerontology, and more specifically, Alzheimer's disease. There's an extraordinary amount of research on caregiving and caregiving burden with dementia patients. Research in caregiving has grown to include studies in the psychological, social, health, and economic impact of caregiving, and we'll kind of touch base on all of these aspects today. Next slide. Some interesting facts. There's 65.7 million Americans that serve as some sort of informal caregiver, or also known as a family caregiver. And they provide care for an ill or disabled relative. Estimates suggest that the number of caregivers will only continue to rise, and we'll speak more of that. The majority of caregivers are females that encompass about 68% of the informal caregivers out there. So the women hold a lot of that, but that's not to take away from the men that also caregive. Female caregivers spend more time providing care. It's about 21 to 22 hours versus 17 to 18 hours per week. So they're just slightly above the men. Female caregivers likely provide assistance with more difficult tasks such as toileting and bathing and some of those ADL tasks, whereas men traditionally assess more of the financing and arranges care, visits, doctor's appointments, and therefore. Research shows that caregivers in rural areas also face unique challenges, including limited access to primary care and emergency health care, as well as supportive services and accessible transportation. And this is why I think it's very important to talk about caregiving and caregiving burden, especially in this area. Next slide. 7 in 10 caregivers are non-Hispanic white. 13% are African American and 2% are Hispanic or Asian American as a rough estimate. A large number of children and adolescents, which are called caregiving youth, are serving as caregivers for sick or disabled siblings, parents, or aging relatives. I find that number quite shocking. There are caregivers that are 8 years old, 10 years old, 12 years old out there that are doing the majority of their caregiving role in their family. Nationwide, approximately 1.3 to 1.4 million child caregivers who are between the ages of 8 and 18. Of the 28.4 million caregiving households that have children between 8 to 18 years of age living there, about 3% include a child caregiver. So that's an extraordinary amount of child caregivers out there. And I don't think we always touch base and recognize that there's a lot of child caregivers out there. There are, and we need to be able to reach out to them as well. Many caregivers of older people are themselves older adults as well. Sometimes you see that correlation there. Of those caring for someone age 65 or older, the average age of a caregiver is about 63, with a third of these caregivers in fair to poor health themselves. 2/3 of the U.S. population caregivers in the future, and 43% report that it is very likely that they will become a family caregiver in the future. So people know that this will continue to increase. Next slide. In the future, by the year of 2030, an estimated 20% of the U.S. population will be 65 years or older. As the American population ages, a growing number of people will be serving as caregivers for family members affected by dementia or other types of functional impairment. Dementia is present in about 10% of individuals older than 65 years and in 40% of those older than 85. As many as 80% of persons with dementia are cared for in their homes by family members. That's a pretty significant statistic there. Along with caregiving and those interesting facts and how many people are caregivers, we know that there is also financial costs associated with caregiving, especially informal caregiving. First, I'd like to just talk to you about some facts that are a little old from 2007, and then we'll kind of compare that with what that looked like last year in 2016. In 2007, the economic value of family caregiving was estimated at about $375 billion. Caregiving to individuals aged 50 and older reported an average of about $5,500 out of pocket in 2007. Long-distance caregivers had a bit higher annual expense at almost $9,000, And if you were a co-resident caregiver, your loved one was within your household, you did see that number come down slightly to about $5,800 annually. And somebody who lived nearby was about $4,500. But that's a significant amount of money that you would spend annually, especially thinking that you are taking care of this loved one for more than 1 year. And that's coming out of your direct pocket. That's not covered with insurance and things like that. Often families spiral downward into poverty as they simultaneously adjust to their roles as caregivers, and that's because of the financial costs there. And often caregivers, they're not at the higher income bracket, so this is precious money that they're spending out of their pocket caring for their loved ones. There's also evidence that midlife women in the labor force who begin caregiving are more likely to leave their job entirely to reduce their hours just because of the burden that it can take on. One survey revealed that persons with Alzheimer's disease required an average of 70 hours of care per week, with 62 of those hours provided by their family or informal caregivers. So that's a significant amount of time, which just proves to the fact that some of these people are leaving their jobs due to the need for caregiving. In 2016, family caregivers of all ages, so this looks at all ages, not just 50 and above, spent about close to $7,000 in out-of-pocket costs related to caregiving on average. Family caregivers earning less than about $32,000 a year are under significant financial strain. Obviously, if you're paying almost $7,000 annually, spending an average of 44% of their annual income on caregiving. So that's fairly significant. Family caregivers of adults with dementia reported nearly twice the out-of-pocket costs than those caring for adults with dementia. Okay. Long distance, without dementia, I apologize. Long distance family caregivers had the highest out-of-pocket costs, nearly at $12,000, compared with family caregivers living with or nearby their care recipients, and that's just because of the distance issue. However, all is not lost. There are some financial savings with caregiving. One I mentioned here is when you are caring for a loved one, you usually have a shorter hospital stay. So on that end, hospital bills and things of that nature are not as much compared to people who do not have caregivers. People who do not have caregivers are often seen to be in the hospital longer or in rehab longer and things of that nature. Informal caregivers often provide care over several years. It's not common that it's just a very acute situation. Informal caregivers operate as extensions of healthcare systems by performing complex medical and therapeutic tasks and ensuring adherence to therapeutic regimens. That's a mouthful, but this I like. Doctors diagnose, nurses heal, and caregivers make sense of it all, and that's really what it boils down to. 2/3 of family caregivers reported providing care for a year or more, while 37% say that they provided care for 1 to 4 years. And another 26% of caregivers provided care for over 4 years. So it's through a continuum. It's not just a single episode there. With all of this, financial costs, the amount of time it takes to caregive, and the amount of people that caregive in the United States, this then leads to caregiver burden. And this is an all-encompassing term used to describe the physical, emotional, and financial toll of providing care. Caregivers often report high levels of burden, stress, and disruption of their own well-being and social activities. It can be very stressful. Next slide. A study with Roth and colleagues in 2009 found that 33% of caregivers reported no strain, and 50% reported some strain, while 17% reported a high level or a lot of strain. Caregivers have shown higher levels of depression, strain, and physical health problems in caregivers when compared to non-caregivers. Interestingly, spouse caregivers who reported strain were at risk for premature mortality, so premature death with spousal caregivers who had high strain. Those who experienced caregiver strain had about a 63% higher mortality risk, which is just astonishing. And this was marked by a widely cited study by Schultz and Beach, which is another highly recommended research paper. If anybody was interested in that, I can give you that information. Due to the demands on their time, caregivers may be less likely to engage in preventative health behaviors than non-caregivers, and thus neglect their own health. And this also leads to strain. There's also biomarker studies comparing caregivers and non-caregivers that often report caregivers have abnormalities in measures of their endocrine and immune system function. So this then goes to a whole nother deeper level. Also, research has shown that viral illnesses last longer in caregivers than in control studies. Older adults in caregiver roles may be particularly vulnerable just to these longer stays of viral illnesses. Due to the demands on their time, caregivers may be less likely to engage in preventative health behaviors than non-caregivers and thus neglect their own health, which is why you see longer viral illnesses and things of that nature in caregivers. This slide I just liked. I thought it was just kind of brought things together, discussing higher burden in caregiving. I like pictures, so I gave you one. Among higher burden caregivers, about 57% provided financial support to a loved one. 75% have had income less than even $25,000 a year. And 77% are concerned with meeting financial needs. So just to kind of bring in that. And then it also talked about more than half feeling burden, or they don't have enough time for themselves, which all lead to burden. Next slide. Characteristics of the caregiver skills are directly related to caregiver burden. For example, active coping skills and management strategies are also associated with lower caregiver burden. Family support, specifically frequent visits by their family members and other presence of strong social networks, correspond with lower levels of caregiver burden also. Next slide. There are positives to caregiving. There's a lot of positives to caregiving, so let's move that a little bit towards the positive side. Many family caregivers report positive experiences from caregiving, including a sense of giving back to somebody who they care for, the satisfaction of knowing that their loved one is getting excellent care because they're providing that care, personal growth, and an increased meaning of a person's of one's life. Some caregivers even feel that passing that tradition on to their children and modeling caregiving to their children, hopefully they'll be cared for in the future as well. So most people look at it as that aspect as well. And I can say that holds true. I watched my mother caregive, and I'll be a caregiver as well, except I need to bring my parents to Maine from New York. A recent survey by the National Opinion Research Center in 2014 found that 83% of caregivers viewed it as being a positive experience. So people are experiencing caregiving as positive. There's just a lot of burden that goes along with that as well. Caregivers may experience both emotional distress and psychological satisfaction and growth effects that are not incompatible. So as I had mentioned, you can have the stress, you can have the burden, but also you can have a lot of satisfaction with it. This is increasingly seen as a positive form of coping with stressful circumstances and situations. Benefit finding may be a product of this ability to find meaning through spiritual beliefs and adaptive coping mechanisms in the face of stress. And that's why people probably are able to do both and manage both sides. Next slide. Informal caregivers are not always identified as patients in the office when they're seeing providers. Therefore, there is often little or no routine assessment of caregivers' well-being by healthcare providers. And there is little attention to problems and concerns they experience or report in their roles as care providers. Family caregivers also often lack support networks. Less traditional primary caregivers also face the added stress of possible restrictions on their access to loved ones they care for. So when I mean less traditional, I mean caregivers who are caring for a loved one, whether they are lesbian, gay, bisexual, or even transgender. These caregivers often face a lot of barriers, and that can add on to burden, particularly when their spouse or loved one is hospitalized or in residential care. And the problem is that visitation privileges, they may be restricted based on what that institution defines as family. So this group of people are definitely at increased risk for burden, and we need to make sure we take care of everybody. Mental health issues are a significant area of concern because depression is the most common health problem in caregivers. It should be screened routinely. Family and individual counseling may be considered for patients with affective disorders or on high-level caregiver burden. Evidence indicates that cognitive behavioral interventions done to help family caregivers benefit family members as well. So it goes across the whole spectrum. Healthy People of 2010 identified the need for behavioral and social initiatives to help promote the health and quality of life of persons with disabilities and their caregivers. So they really started making this more pronounced and a need to identify this in 2010. As a result, the above factors, the health and well-being of family caregivers and the subsequent ability to assess their care recipients, it really is a public and mental health priority at this point in time. So what can healthcare workers do? For any of you watching who are healthcare workers, you might be asking yourself, well, what can I do to help this and to help our caregivers? In a day-to-day practice, providers are likely to see patients who are served and are serving as caregivers. In fact, a study of patients in the family practice demonstrated that 21% of their patients had caregiver responsibilities for persons with chronic medical conditions. So it's sometimes important to ask those questions, especially if you're noticing depression and strain in patients. Are you caring for another loved one? What are these extra causes of your symptoms you're experiencing? Providers can teach their patients who are caregivers new coping strategies to make appropriate interventions for those caregivers who are overwhelmed. Patients who provide care to family members or friends with dementia are likely to be in a family physician's practice, and this can give the family provider an opportunity to help patients cope with challenges of their caregiving role. I know here and in my practice, I try to screen for that, and often the caregivers come in with their loved ones. And yes, you might not have that visit for the caregiver, but it might be a good opportunity to make sure that that caregiver is getting the help that they need and they're getting the exact care that they need. And if not, then you can kind of start to streamline that care and have them maybe come in and see you as a provider. Next slide. This is just a quick visualization on a questionnaire that can be in offices to recognize burden, and it's just a rating system, and sometimes offices can use these for their caregivers, and it just helps identify burden. Next slide. So what can a caregiver do? So we talked about what a healthcare provider can do, what can a caregiver do? And the number one thing a caregiver can do for themselves is self-care. That is absolutely essential for caregivers. Self-care is any necessary human regulatory function which is under individual control, deliberate, or self-initiated. Self-care can be a variety and a full range of things. But there's really three main reasons why self-care is so important. If you don't provide good self-care, you may no longer be able to care for your loved one. A main reason to focus on self-care, because without it, your own health may diminish, and then you can't care for your loved one anymore. Reason two, you may lose friends, and you might have a lower quality of life, and then that can also lead to not having that support system that is so important. And number three, you may put yourself at risk for an early death, which nobody likes to talk about, but that's just not caring for yourself. It can increase mortality. Next slide. Help is out there. Don't worry. There's a lot of different ways that caregivers can get help. Adult day services are an excellent source of respite for a caregiver, and they can provide a lot of engaging activities for their loved ones, so you're not feeling that they're not being cared for. They really are. There's just so much out there, especially in respite care. Active coping strategies are important, such as constructing a larger sense of an illness that you're caring for, and this is associated with a lower incident of depression among caregivers, and that just really brings back to the basics. What are these chronic illnesses I'm helping care for? Let me understand it. Then maybe some of the actions that my loved one is doing may not be their fault. It might just be the disease process, and that sometimes is easier to understand and cope with. Support groups, individual and family counseling, caregivers who use problem-focused strategies. That's also very important. And because of the lack of understanding about a family member's disease process, as mentioned above, may worsen the caregiver's stress. And so knowledge is really the bring home message on this slide. Coping tips: educate, knowledge, right? Find sources of help for caregiver tasks. Protect your personal time for something you enjoy or you need to get done. That's part of that self-care discussion. Try to find time for exercise, eating well, sleeping enough. All of that keeps your health up, keeps your spirits up, makes you feel well, and you're functioning good. Use your personal networks, family, friends, support groups. Watch out for symptoms of burden. If you're feeling burden, you need to talk about it. Notify your doctor if symptoms of depression are present, and consider how you would feel and what you would do when you're no longer caregiving. Sometimes people say, just like empty nesting, I'm done, so now what's new for me? What's next? Next slide. So where to turn? There's many different resources out there on where you can go and where to turn to seek help. Here at Harrington Family Health Center, our behavioral health is a great option. We have counseling and a lot of great avenues that our counselors can do and can help cope and help with these symptoms. Obviously, providers, see your provider. There's plenty of us providers here now that can help manage that stress and burden. There's also some local agencies out there, the Eastern Agency on Aging that's located out of Bangor, and the Maine Aging and Disability Resource Center. I know they have a lot of programs in Ellsworth as well. And then there's a huge resource online, more than I think anybody could ever filter through. And I actually have a handout on some online resources for caregivers that I can hand out that are just so beneficial. The internet in this aspect is great to have. Next slide. So always remember, we change the world when we simply meet the needs of another. And just simple things like that remind us why people caregive and why we do what we do and why we love it. And we just always have to remember that and stay positive. Does anybody have any questions on the presentation? These are just references. If you want to just skip through them real quick. And then the next slide. Perfect. Any questions or comments? I made some little anti-stress kits. If somebody wants to hand me one, they're fun. And it's just a fun idea. And there's just some topics that we talked about: finance, your limits, burden, feeling frustrated. And it's an anti-stress kit that says a penny so you'll never be broke, a rubber band to stretch beyond your limits, a Snickers because laughter is the best medicine, ribbon to hold things together when everything falls apart, and confetti when you feel like throwing something, hugs and kisses to remind you that you're loved, and tea because life is like a cup of tea and it's all in how you make it. So I just wanted to thank everybody who's here and who viewed online. And together I think we can help caregiving. And I think we can hopefully help our caregivers to live a healthier life Again, as I mentioned at the beginning of the presentation, this is kind of a presentation series that we're hoping to do here. So there'll be more presentations to come by our health center, so I hope everybody stays tuned for those, and the next one will be in January. Thank you.
Thank you.